Welcome everyone. Today we have another new episodes, and I'm sure that this is very important sessions for all of our audience. Specifically, we do discuss on healthcare policy. We have our policy expert, Dr. William, as well as Mr. Alex. He's an activist, and some of our guests they will join later. But policy is very much important in the COVID-19 situations. So hopefully we will figure out some of the issues in an effective way. So I want to start with our policy expert, Dr. William. So hello, how are you today? What's the situation in USA?
Okay, well, first, good morning, good afternoon, good evening, wherever you are, and depending on when you are watching us. So welcome. The COVID situation in the United States, much like the rest of the world, is uneven. There is well, we've got the two separate influences and trajectories. One, we do have the virus, although we are experiencing problems with the logistics, which would be true of any kind of large-scale rollout, administering the vaccine, and not just one vaccine, but multiple vaccines. So that's on the one hand. On the other hand, much like the rest of the world, because we are not that unique, it's a question of this surge on top of a surge on top of a surge, given the holidays that the world has been going through. Here in the United States, we are currently in the surge on top of the surge, which is the lagging indicator after the holiday travel season for Thanksgiving. We are now in the midst of the travel season for Christmas, Hanukkah, Kwanzaa, and other festivities, including New Year's. And so we won't see the manifestations because infection rates and or death tolls are lagging indicators. We won't see that manifested until, like, say, 10 to 14 days from now and then thereafter. So there's a real concern, at least here domestically in the United States, that on top of the current surge, which has completely exhausted all of our inventory of ICU beds across the nation, that with this potentially disastrous third surge, that the United States might be in very bad shape. Now, you combine that with what's going on across the globe of the new strain of the highly contagious strand of COVID-19, not more deadly, at least according to the scientists and the experts in the medical field, but just its spread rate is much more effective, which you would expect from a pandemic disease trying to survive, feeding off the hosts of other beings. So not that outbreak, and then what's going on, I guess, in Europe when they are starting to administer the vaccine, and Europe has at least the European Union, they have, I believe, a population of over 400 million people, and that doesn't even take into account India and the Pan Nations or China. So it's uneven, but we are hopeful, although we are looking at difficult days ahead. So on that note, what I can say is that there is light at the end of the tunnel, although we now know that at least it's not the headlight of a train coming at us.
Thank you. We have our Professor Jalal. He is an expert in policy development from Africa, as well as he has a huge contribution in United Nations. So Professor Jalal, how are you today? And can you share the present condition in Africa, especially healthcare system? And most important thing, what do you think about the healthcare policy?
Thank you, Sharif, for the invitation, even though it was really very short notice, but I thought it would be my pleasure and my honor, to join, the speakers in this exchange, especially during these times where everybody is trying to see 2020 behind us and hopefully a much better 2021, especially due regard to this virus, which seems to be, kind of relentlessly keeping alive and making our lives kind of challenging. As we all know, I mean, things started, quite, how do I say it, calmly in Africa at the beginning. The first wave in Africa was quite mild, okay? As a matter of fact, I am from Tunisia, from North Africa. And the first wave, we had was quite manageable, which was good to some extent. So the system, our health system, was able to cope with it. And of course, since the population was so much afraid of this unknown and invisible killer, people tried to really stick as much as possible to, the government's recommendations as far as wearing masks and keeping, the right and safe distances, as well as, washing hands according to the recommendations. The same thing somehow also happened, all over the continent. And you all know that somehow many started talking about, maybe the genetic specificities of Africans, and also, uh, so many other maybe explanations, because of the weather, because it's really kind of hot, and the virus doesn't resist as much in hot weather, and all kinds of really interpretations that were not based on scientific, arguments, knowing that, of course, the virus is unknown, and consequently trying to study these elements and their effects on the virulence of the virus wasn't possible. All right. Unfortunately, today the second wave is really becoming basically a tsunami, all over Africa. And unfortunately, this tsunami is really having very, very severe impacts on the continent, because, as we all know, in most of the countries, the health system is not really well prepared to take care of such kind of, health tsunami, especially, as you all know, especially for the severe cases, either, to have, ventilation, for the severe cases. And consequently, many, many countries and their hospitals and their, health system saw themselves really drowning under the number of severe cases. And I am in North Africa, and we have a quite similar situation in Tunisia, and the second wave is really being quite, difficult to deal with, especially that, as you all know, the policymakers had to kind of balance two very, very, challenging, objectives. From one side, saving, the health and the lives of people, and on the other hand, trying to keep the economy going. And this has been a conundrum all over the world, of course, but it is a much, much more challenging conundrum in Africa and countries where the economies are, weak, if not really poor. All right. So as during the first wave, maybe the first reflex of decision maker was, okay, let's save lives before anything else. And once, we control the virus and hopefully get the vaccines, then we'll be able to jumpstart again the economy, and somehow, how they say it, catch up with whatever was left, from the devastation of this, virus. And like in Tunisia, the government tried to really inject as much money as they could, to help people who somehow didn't work and had to have some minimal financial support to keep, spending on themselves and on their families was quite costly. Okay, so when the second wave or even the second tsunami, came, and here to really give you a feel of why I'm calling the first one a wave and the second a tsunami, is that what we had during like the first wave, like 3 or 4 months, we had about 1,200 infections, and about 50 deaths. All right. Today we are having that in one day. Okay, so whatever we endured during 3 or 4 months, we are enduring today in just one day. So the explosion has been quite important, and consequently, that's why I'm calling it a tsunami. So that conundrum became much more challenging, and consequently, most of the countries, such as in Tunisia, the decision makers decided that they will give as much leeway to the economy as possible while trying to minimize the impact. And that's actually what's really going on today. And of course, everybody is gasping for, getting the vaccines. That's now the big question. All right, and we hear so many things about this vaccination issue, and there are some troubling, really, informations and news due regard this vaccine and the vaccination of the developing world and the least developed world. And really, that is my concern that I would like to discuss with your guests and with your audience today, because that's, I believe, the most pressing, issue if we really would like to help the developing world and save as many people as possible, especially that their, sanitary and health system is really far from being able to cope with the situation, especially if they have to wait too long for this vaccine. The first challenge is, the first vaccines or the vaccines that are based on mRNA technology, the new technology, which is a very highly welcome technology, requires, very low temperature, for the distribution of this vaccine. And, minus 70 degrees Celsius, that's really very difficult and challenging technology to have in such kind of countries. So already we have a big barrier, as far as acquiring this vaccine and being able to handle it in adequate conditions to be able to administer it to people. As a matter of fact, I hear even in Germany, they have been having difficulties with this issue. So if they are getting, some challenges, technological challenges, handling the vaccine in Germany, what about, developing and least developed countries? So this is already a big challenge, and I wonder how are we going to deal with this challenge? The second challenge is that we hear that at best, only 20%, and that's what the WHO seems to be saying, basically 20% of these populations would be vaccinated, and we all know that 20% is not enough. We have to go all the way to 50, if not 60% of the population, so that we really can talk of immunizing whatever population we are talking about, knowing that most of the Western world is really shooting, and going for that, objective, if not more. So already here we see that there is some kind of huge inequalities, where the developing world not only find itself with extremely weak sanitary conditions, is really, far from being able to handle the technological, requirements, such as low temperatures, and not enough productions, to be able to cover at least 60% of these populations, and only, and having access only to 20%. Okay, so these are very, very really challenging issues, and I believe they are even also issues that have to be discussed from the ethics point of view. Okay, so many people from the south now, and rightly so, they are starting to ask questions: are the lives in the West, how do I say it?
Worth more.
Worth more, exactly. Thank you, Dr. William. Worth more than those in the South. And this is really a very, very big questions that all of us have to keep in mind, and consequently need to find solutions to this issue. And I would like to finish with one article. Actually, I was reading today, a very interesting article. I mean, we can say more about these issues later on. Is that, some people were able to prove, which is something intuitive to people who are involved in research, especially in general, and biotech in particular. This vaccine that we have today, or most of the vaccines, they are now protected, of course, by property rights. And what is very sad is that those companies who have the know-how today are resisting sharing their know-how with some other countries, such as India or South Africa, to be able to produce these vaccines, so that the developing world can have access to more than 20% of these vaccines. And that's really saddening situation, knowing that these vaccines are based on a long history of research that is today coded in published papers in international journals. So claiming that the know-how is really belongs really to the pharmaceutical industry, okay, and consequently it's their right to retain that know-how through, of course, patenting, etc., and not have it open, especially that it is a vital issue. Here we are not talking about luxuries or anything of that nature. We are talking about lives, and all lives are the same all over the world. So, and I would like to finish with somehow a preliminary conclusion to whatever I said, is that, you see, this crisis has shown us that humanity is failing. Okay, we are failing in the sense that, and we see it in the most supposedly advanced countries, that their health system, was somehow so ill conceived and deployed that today in Africa, in America, we see the highest numbers of infections and the highest numbers of deaths. So this is the most developed, technologically and scientifically developed country, is having tremendous difficulties, dealing with this, health crisis, which is, to me, as a scientist and as a global citizen, is utterly unacceptable. That means there is something wrong with the way we have really developed for the last few decades. And to me, of course, the first culprit is this, hedonistic, I would call it hedonistic capitalism that has been, running the show since the 70s, and that somehow conceived of such a situation where greed was and individualism were really the main driving forces behind how society developed and how society is willing also to develop. So I hope that the post-COVID will learn from this crisis, and that we as human will come together and really tackle head-on these failures and come up with a new way of cooperating, being together, so that we can all live in a dignifying manner, as well as being stewards for this planet, which I would like to call it our Mother Earth. Thank you very much.
Thank you, Professor. Thank you, Professor. Mr. Alex, from our honorable speakers, Mr. Professor Jalal, we try to understand the real scenario of the global community, especially in the healthcare system, as he is highly experienced from UN and academia, and as a scientist, he has a very good contributions. But my question is that as you are activist and you have a strongly involvement with the US economy, especially California, so how do you want to share your experience specifically in healthcare system in USA right now?
Okay. Yeah. Well, for me, good morning, everyone, and thank you. How do you say your name? Jael?
Yes,
Jalal,
Professor Jalal.
Okay. Thank you.
Thank you.
Yeah, we all of us, myself on the panel and the viewers, I'm sure greatly value your you being on this show and your contribution and your knowledge. So, and again, William's always great knowledge, and thank you, Sharif, for this show. So I'm going to go ahead and explain my background in education real quick regarding healthcare. So I have taken all the Red Cross courses, which is basic emergency first response. I have taken the EMT course, which stands for emergency medical technician. So I'm not saying that I'm super trained, but I know I know all the basics because I've taken some of those basic classes. I've taken multiple courses in fire technology, not only like hazardous materials, but one specific to this conversation. I have taken nuclear, chemical, biological first responder. So that college course was broke down into different sections. So 1/3 of the course was directed towards, epidemic, pandemic, or biological attack. So throughout that course, the teacher always discussed, this was around 2009, 2010 that I took this course. The teacher talking about pandemics always said, it's not a matter of if it's going to happen. It's always a matter of when. That's how pandemics are. It's never if it's going to happen. It's always when it's going to happen. And the teacher repeated that through like so much of the class in that section of the course. So what we saw with Ebola, with Zika, with what we're seeing with the coronavirus and other epidemics around the world are, they're going to happen because of the exponential increase of the human population, us moving and living in new regions. And now that we're seeing the permafrost melt in the Arctic ice caps, new viruses, new strains are going to be emerging that our bodies and our immune systems are unfamiliar with. So I do want to say, from all my training and background experience and disaster relief missions I've done around the world, it was during the beginning of the Ebola outbreak, and I started seeing the spreads, just like I started seeing an article here and something there, and I started hearing people talk about Ebola. So I started just getting heavily involved in researching about Ebola, the spread, the cause, everything regarding what was happening in Africa. So I started posting on social media, talking to my family and friends, and I finally announced on my Facebook, that it was going to be a huge issue, it was an epidemic, and that I was traveling to West Africa to try to help solve it. And that was like a month before President Obama even declared it was emergency. So I was way ahead of the curve. I raised enough money. I got all these supplies and all this equipment together, and I actually traveled all the way to Ghana. And this was towards the beginning of the Ebola outbreak. By the time I got there, it was starting to peak. A lot of people were dying. And I did have a chance to go to the headquarters, the staging area, where the World Health Organization, the CDC, a lot of other aid organizations, Doctors Without Borders, United Nations, and other governmental and non-governmental entities were staged. And so I learned a lot talking to them and Ebola. And what was most upsetting is me being over there, seeing all these professionals desperately trying to save lives, me working with these professionals, seeing what was going on from my perspective, and having people specifically in America with the audacity to say that it was not real and that it was fake and it was a hoax and it was made up. And over 500 doctors and nurses sacrificed and risked their life. Over 500 doctors and nurses risked their life, and they died treating people from Ebola from spreading around the world. Ebola had a death rate of 50%. And even though it only infected around 30,000 people, it killed 11,000 people. And over 500 of those were in the healthcare. So I can't even explain the frustration and how difficult it was going over there and trying to help, and then people on my Facebook constantly saying it's a hoax, it's fake, get out of there, it's not real, and all this. So when I came back to America, obviously I was disgusted and let down with people's response. And I always thought if there's ever another pandemic, those same people that are spreading misinformation, reading misinformation, are going to slow down our potential ability to stop any other pandemic that we ever come across. And that's exactly what we saw with this pandemic. We saw a lot of people spreading misinformation, saying that this is as bad as the flu, that it's not killing people or whatever. So it's a huge concern with how much misinformation spread on the internet and how it slows down our ability to save people. And just one more thing, I do want to commend Doctors Without Borders. They did an amazing job, and I think they helped save people around the world. So cases jumped to 36. 36 other people got cases, I think, in 15 countries. And those, that was spreading to other places. Thankfully, with Ebola, you can see the symptoms, you can backtrack, and you can find where it was coming from. So we had a better chance of solving it and stopping it. With this pandemic, since so many people are asymptomatic, they spread it. And like I said in January, posted on social media, talked to the mayor and senators, you can't stop a virus from spreading when symptoms are asymptomatic. If someone's going around spreading it to other people, you can't stop it. So anytime we implement face masks, social distancing, washing our hands, staying at home, all of those are to change or reduce the R0 value. Now, the R0 value is the rate that it's spreading. So if it's spreading over 1, then it's spreading to more people, and then it has the ability to take off exponentially. I think the seasonal flu is like 1.1 or 1.4. So it's just barely going up, not necessarily exponential. When this virus started spreading exponentially, that's when 2.1 people were getting sick. And that means one person's giving it two's giving it 4. So that's how it works. So anytime we do some of these steps, it helps reduce the R0 value and we spread it to less people. So even if we do hand sanitizing, face mask, washing our hands, all that, and we incorporate 20% of a country's vaccinations, it doesn't solve everything. It doesn't save everyone, but it does help reduce the R0 value so they can get a better grasp on it. So a lot of people in California and America are like, well, why are we going into lockdowns? What's going on? And we don't like it in the economy. So the reason why they do lockdowns is because the hospitals are overflowing. They're full. So we go into a lockdown for a couple weeks or a month until there's room in the hospital for people to get treated or die. So since so many people aren't taking all these necessary steps, that's the government's last hope and one of the most effective things. But yes, it does have a huge impact on the economy. And so that's why you try to keep essential businesses open. And it would be so much easier if everyone was safe, if everyone just wore face masks, washed their hands, stopped going into crowded areas, stopped meeting up with all their friends, kept their inner circle smaller or reduced it to 0, and just stop putting elderly people at risk and people with a weakened immune system. It's just really selfish. So there's all those aspects. There's also just building up your immune system and, doing research regarding all of that. Because here in America and probably elsewhere around the world, we're so deficient. There's so much of America is just drinking soda and eating processed food and non-organic healthy. Just a lot of these corporate companies are pushing all these low products on us, and it's not making our bodies as strong as they could be and more resilient towards any potential threat, whether it's a pandemic or, epidemic or anything. So some countries did try the herd immunity, and obviously that didn't really work quite so well. So yeah, vaccinations are best option. Now, I'm a supporter of vaccinations. I do eat healthy and organic, and I'm super conscious of everything else. But when there's no other option. The vaccination is going to help solve this pandemic, and that's the bottom line. Regarding universal basic income, which we constantly talk about in this program, would have helped through this pandemic. Stimulus is also a great solution. Unfortunately, we're not implementing that, and a lot of people are suffering in the United States. So many countries right now have universal health care, and the United States needs to incrementally incorporate and reform the existing healthcare system. I know there's Medicare, Medi-Cal, there's things for children. There's certain programs in place. There's like 10 programs in place, but it's still not enough because you still see people that are so disabled they can't even fill out the paperwork. You still see homeless people all throughout our society that are suffering. So mental health is also a huge issue that we need to address in the United States. And once we address mental health issues through social services, I think we can get on top of a lot of this other issue. And then that's kind of what I wanted to add to this conversation. And just the pharmaceutical industry is really horrible unless you really need it. So I'll go ahead and give it back to the floor. Thank you.
Okay, thank you. Dr. William, there are many points come from the developing nations as well as some of the practical experience from USA. And we can understand that we have to reform our healthcare system. I think not only USA, every country has a lot of challenges. And I think this world actually reality is that we are not prepared for this kind of pandemic. So we do a lot of innovations, a lot of scientific development, but I think that we need to be more careful about our healthcare system. So what the strategic point of view you want to add for today's session?
Okay. First, I just want to say thanks. I mean, for all the part of the race, both from multiple perspectives, first world, third world, and a number of issues. I guess I would say this, that with regard to our topic today, the future of healthcare policy, given the impact and the repercussions of the COVID-19 pandemic, I think I would look at it this way: that as we move forward, and this is before I drill down to some of the other items that have been raised that we're going to get to that are such that it's simply this, that what COVID-19 has really highlighted, look, as a general premise, the COVID-19 pandemic has exacerbated, put on steroids, or accelerated both the things that we know and the things that we don't know. It has accelerated and highlighted our deficiencies in a way that has made it crystal clear in terms what was before just policy discussions is now crystal clear, because you see and you can measure the impact in terms of lives and deaths, and you can't get any starker than that. Now, with that in mind, if the question is where do we go from here, then here are the issues. First of all, and this obviously is a United States based or United States centric kind of analysis. But it may have notions or benefits to the rest of the world. But from this perspective, here in the United States, what it did was it highlighted this notion of what we mean by insurance coverage. And in that regard, just at the base level, because there are like four major points, and I'll just go through the four major points here. The impact and the future of healthcare based as a result of COVID-19 are going to affect these areas. One, insurance coverage. Two, future stability of financing for the healthcare system. Three, the racial and ethnic biases and disparities that we've seen that this pandemic has highlighted. And four, exacerbating the need and or how we go about recruiting and training future medical professionals. Now, with regard to, at least here in the United States, with regard to insurance coverage, we have been trying to figure out a way and get to, say, a universal health care plan, or at least some here in the United States have been trying to do that. There are a number of barriers. Some of the barriers that certain insurance companies are only licensed to operate in certain states, because each state has its own guidelines with regard to the certifying and qualifying plans that can be administered in the state. So essentially, you have, for each jurisdiction, you have each separate standard. Now, some of those standards are similar, some of them are very dissimilar, both in the requirements. So, for example, the requirements to be certified as a plan state, for example, in a state like Texas might be very, very, very different than New York, and New York might be very, very different than California. As a result, for one insurance company to offer coverage in those two states, they would have to comply with 3 different mandates. Now, that is a huge problem in terms of the excessive waste of administrative costs. Just so if you're one plan and you want to cover 3 different states, there's an inherent barrier, and that's the economic cost just to get into the game. Now, what we've seen with with the pandemic, has been that, listen, we needed to break down some of those barriers, just on basic things, because it came from other areas. One, we needed to get nurses from New York to Arizona or to Washington State, and get people from Minnesota down to Texas, or get them over down into Florida or South Carolina. Now, with each of the differing licensing requirements, because this licensing mandate goes through all facets of the issue, but that highlighted the need that we needed to streamline here in the United States through 50 different jurisdictions the insurance coverage ability of companies to provide the same kind of coverage and or to provide medical help across state lines. Now, the United States government has been doing this, and states have been doing this through interstate compacts, at least on an emergency basis, to reduce those barriers. That's number one. We're likely to see more of that. And that is going to be helpful, because that's going to begin to chip away at the overarching administrative costs. And as you begin to lower the costs, you at minimum free up resources. And then the question becomes, where do those resources get redeployed, either by way of savings and reducing the overall cost of healthcare, or whether or not they get put into those areas of need. Now, number two, the stability of financing. And just to put this into perspective, as we talk about the entire globe, and this should be, I found it quite interesting, but we'll just run it around the block and see what happens. I say to you $4 trillion. Now, if I say to you $4 trillion, and we go down a list of the world's largest economies, $4 trillion is more than Germany, the United Kingdom, India, France, Italy, Canada, and Korea. But that $4 trillion is just what we spend here in the United States only on healthcare. Our healthcare bill here in the United States is more than 1, 2, 3, 4, 5, 6, 7, 8. 8 other nations. Their entire budget we just spend on healthcare. So here's the question. Why is it that we have $4 trillion here in the United States and we can't come up with a comprehensive health system? Now, Jalal, you're absolutely right. I mean, I disagree with your conclusions. I want to be upfront with you that I don't see it as a hedonistic, capitalistic endeavor. But you're absolutely right to point out that why is the most advanced nation with the world's largest economy spending $4 trillion, which is more than 9 other nations? Why can't we get our act together? Valid criticism. Invalid conclusion that it's a result of hedonistic capitalism, some other, large, all this other stuff. It's a matter of cross-regulation and what we've been doing inefficiently, and that's because of the vested interest. Those people that currently benefit from the current system not wanting to change the current system because it's to their benefit. More regulation means that there are more there are more stakeholders. More stakeholders mean there are more invested people with invested interests who don't want to change. I get all that. So the question, nevertheless, moving forward is, how do we say we've got $4 trillion? How do we better spend that here in the United States? And this is the way we do it. We reduce administrative costs. That gets to the issue of health insurance coverage. We then start talking about where that dividend from the administrative savings can be redeployed and be more efficiently. And here is one of the silver linings from this pandemic. And that is now what I believe to be, and what people I suspect will agree, like minds, and that is the inception of the digital health policy impact. And quite frankly, that simply means telehealth. That we now, with the advent of the internet and robotics and stuff of that nature, we can reach more people through video conferencing just like this, so that doctors can meet with patients who are often in remote areas. That is going to be one long-standing thing. That has reduced the overall administrative costs. I don't need to necessarily have a brick and mortar place at some remote area in order for me as a doctor, I'm not a medical doctor, but for a medical doctor to reach and treat a patient out there. That's going to be one of the ongoing growth. And by extension, an implication and impact on the rest of the world is simply this, that means that before it was only the purview of the ultra wealthy in developing nations to access healthcare in the United States, which was considered better than what is being offered in certain countries around the world. That is no longer true, because now medical technology and medical expertise can be exported through these remote collaborations, which is what a colleague of ours, Rob, who often appears on the show, has talked about, and that is the acceleration of remote collaboration. And so we can use remote collaboration as a tool to export expert medical advice across boundaries. And that means for the United States itself, importing it as well. So that is actually getting the best of the best around the world and putting it down in a situation whereupon we can deliver it to the rest of the world in a number of areas. Now, I want to hit another area, and that is this, and Dr. Jalal, you raised this as well, and that is this issue of breaking down racial and ethnic disparities in healthcare. And what this pandemic, once again, did is it highlighted. And most recently, it's a real shame, and perhaps this is a point for you, because I want to be fair to the hedonistic capitalists that are out there. And that is that there was a report out of New York City that said that there was this one private medical company, and I think I'm butchering the name, it might be Car Care or something of that nature. Understandably, there's a major investigation because there were people skipping in line with the money and the resources to attempt to get access to the vaccine ahead of their prescribed schedule. That's they were using their money to buy their way to jump the line. Well, people are going to do that. And that is no function of what kind of economic system you have. That's just people just because that's what they're going to do. They cut in line at the store. They'll cut in line, to get on the amusement park rides. They're going to cut in line to get the best medical. They're just going to cut in line. They cut you off when you're driving. Nothing you can do about it. It has nothing to do with the economy. Nevertheless, it raises this point. That is the economic disparity. And to a larger point, I want to underscore a point that you also raised, because I think it's valid as well, and that is, at a macro level, that is the disparity between the first world nations and the third world nations, those that have and those that have not. And that's a question of the cutting in line, although it's more complicated the way you raised it, and certainly that involves it. However, COVID has raised this issue. You've got certain countries buying up, all of the available potential production. And it's not just the United States. And I don't want to make the United States, this boogeyman out there, because quite frankly, I'm simply going to point to this. The United States has not purchased enough vaccination proposals to cover us, and it's well aware. And it's partly because of logistical failures here at the administration. But there is one country that has bought so much that they are now willing to share it with their bordering countries for free. And that is New Zealand. So if you're telling me New Zealand, which clearly is not does not have the same size economy as the United States, they have enough vaccines to cover their entire population 4 times over, and they have more coming. And so apparently New Zealand is hoarding. But that's just the point to say America is not the boogeyman of the rest of the world. That having been said, though, the disparities between the rich and the poor. Now, here in the United States, one way to do this is going back to this. We got $4 trillion, we can reduce administrative costs, and the way we can do that, the best evidence that shows how we can control healthcare costs is through universal healthcare. And that way we can control the cost. We get administrative reductions and savings, we get cost controls and savings, and what that does is it then allows us to provide a plan of a sufficient level that covers everybody the same. Which means that, whether blue, brown, yellow, green, black, white, rich, poor, whatever the case is, you get access to the same medical treatment. And I know that if I'm spending $4 trillion, which is, 9 other countries, I know I can put enough together to get the rich people happy here and also cover the poor people here in the United States. And that's called a universal plan. Now, as Alex pointed out, there are always these people that are naysayers. for whatever reason. They're ill-informed, they don't know, but they're out there in oppositional defiance. They just want to throw tomatoes. And so they'll say no to anything. And then other people with vested interest, they're just going to say no. But the policy for the future and the impact of the pandemic, COVID-19, is this continued incremental step towards universal healthcare. Now, here's the thing that just kind of gets me on this one, and that is simply this, that at the end of the day, it's about reducing the barriers and reaching the efficiencies. COVID-19 and all of its benefits and all of its pitfalls has exposed the fissures, the valleys, the cracks, just all of the broken parts, and shined a light on it. It's also highlighted our path forward, because now we know, and we can invest in those areas that work. And by investing in those areas that work, telehealth, reducing barriers, at least interstate and by interstate, and by extension, intercountry or transnational, by reducing those barriers and sharing the expertise through remote collaboration, that all helps. And that gets more of the information out there. It's not going to cure everything. Joel, it's not going to cure the fact that companies, because they now have a patent, are going to seek to exploit that patent for the next 20 years. Can't do anything about that unless the United States federal government steps in and changes our patent system. But it's also not going to change some of the predatory practices that other nations are out there doing and engaging in on third world countries. No different than what China is doing or Russia is doing when they are going to these third world countries and saying, we've got a vaccine that's unproven, that's cheaper for you, and we're going to force you to buy it en masse. So, I mean, there's a whole bunch of bad actors out there. Not going to change that, but it's a step in the right direction. So if we can get through the issue of dealing with insurance coverage and doctors across state lines, doctors across borders worldwide, if we can deal with the issues of stability and financing, and if we can put out a model here in the United States, one that can be replicated in other countries, and just leapfrog that's through digital policy, telehealth, and those kinds of things, and or then universal steps towards universal healthcare policy, which would lead to a reduction in the disparities, both based on income and race and ethnicity, and in some countries, religion. Because religious factions in some countries, when they're all look the same, the religion might be the dividing factor. People in the world have great ability to divide each other based on whatever it is. I have one ear, Alex has two, he's bad. I'm great, you know. Sharif has one eye, he's all seeing. I have two, I need glasses, I got four. It doesn't matter here. However, fundamentally though, we then need to deal with the issue of recruiting and training medical professionals. As we've seen, it should not be a system, at least in the United States, where there's not enough medical professionals, emergency service workers, nurses, specialists, or doctors in any particular area that each state has to import them from one state to another. Likewise, it is not sustainable and it is not advisable to have to rely on an international organization such as Doctors Without Borders when a country like Ghana needs assistance now, and they need the expertise now, and they don't have it, and nor the country will loan it to them, so they have to rely on an NGO service organization to come in, hoping that they have resources. Listen, the way to living longer, and the way to planning this world out is not left on a hope, a prayer, and a roll of the dice. So COVID-19 has highlighted these things. Those are four areas where this pandemic, we're going to be living with, hopefully, the beneficial results of this pandemic long after it's gone, but we see the road clearly moving forward. Now, I tend to think that, activism, to get on all those points, pick an area, get a group of friends and go after it. But it seems to me that those are the four basic precepts by which we can then move forward, at least as we're looking at the COVID dividend once this pandemic is over.
Thank you. This is really nice discussions, as well as we get very good response from audience. Specifically, they have few questions. I want to go for the open discussions, but I want to take few questions from audience, and then based on the priority, you can give the answer. Onika Shams, her question is that, hello sir, how the developing nations improve their healthcare system? Mahdi Hassan, during the pandemic, how can the test will be free of cost as many countries already provide this benefit? I think her country, he do not get enough testing as a free. Nur Fazrin, can you please discuss the necessity of supplement in the maintaining good health? Alea,
Okay.
what are the major challenges for some nations to ensure the quality of treatment for all citizens? I think there is another things. Labib, does the new strains of COVID from UK cause more serious disease? I think this is one of the major issue right now. Taharin, how should we rebalance health spending commitments to match them
Okay.
better to resource? And final things, what do we want to healthcare system to do, and how do we measure it in performance? So this is some of the questions. Actually, audience has different perception, different questions, and I just want to relate with audience and our speakers. That is the point. I just taking few questions. So I want to start with Professor Jalal, then Alex, and then Dr. William.
Well, what can I say? These are very interesting questions, and
Mhm.
there are no straightforward answers. Already, with Dr. Williams, we don't see things, the same way, which is acceptable, and these, conversations are very, very important to bring people together and try to also bring their ideas and their positions, closer. It's not necessarily that my idea or Williams or Alex's idea be the winner, but most probably something that combines all of them or something completely new that satisfies everybody would emerge. And I am very much for that kind of synergy and the emergence of new solutions. I would like to answer, some of these questions, but I would like maybe to uh, give an answer in an indirect fashion, because asking how a country can really, for instance, have a universal health coverage, which is to me a human right, and every
Mhm.
responsible government and society has to provide that. There is no doubt about it. Okay, if there is one ailing person in a society, the whole society has to feel that and has to be able to cater towards a better health for everybody. A big issue in humanity is that we really haven't developed how to care for the commons. That means the common goods. And systems such as healthcare, education, transportation, the air we breathe,
Mhm.
okay, these are commons that we are all using. And as a matter of fact, they are even transboundary kind of and transnational commons. And so far, I must say, humanity is still really very, very much behind dealing with these issues, even though in 2009, the Nobel Prize in Economics was given to the first lady. She wasn't an economist, she was an anthropologist, Professor Ostrom, who really worked on these issues. And, as I said, it's 2009. So that Nobel Prize wasn't given to this lady on this specific topic for nothing. Remember, 2009 comes after 2008. All right. So, uh, uh, you know, in countries such as the US, sorry, Williams, I'm gonna, uh, uh, you know, I cannot make this argument without going through the US.
That's right.
Why we say that we have, you see, because, it's not only the COVID that is unmasking our failures. COVID is doing it in a very, brutal fashion, but, global warming is also doing it, but is not maybe in as much forceful manner as, COVID-19. And let's not forget, before that, we had also, and we still have, our nuclear arsenal that could really, kill humanity for any mistake here or there. And people who know about this, there has been mistakes, and we just avoided the Armageddon by chance. Okay, so how long is humanity going to really plow ahead while really being unable to really manage, these big challenges that we created? Okay, because let's not forget that global warming is not something that happened. Okay, global warming, we can trace it back 500 years ago to industrialization. Okay, so CO2 emissions, which is the main culprit for global warming, is due to fossil fuel, consumption, and utilization. So it's us, it's we humans, that have somehow facilitated the emergence of these challenges because of our ignorance, first of all, because nobody knew, at the end of the 18th century or beginning of the 19th century, that, for example, all that fossil fuel consumption is going to really get us in this situation. So, but today we know, this COVID business, as Alex said early on, so the scientists were talking about this long, long ago. They said it's going to happen, and it will happen as well. Okay, so and we had to be ready. Okay, nobody is said that it's going to be the end of 2019, because even though we could read in some kind of books, that some people have managed to almost get the date right. I don't know how they did it, but serendipity happens. So these are some key questions. And going back to how could we get a health system in any country working, in a proper fashion, where everybody is taken care of, at least for the basics, okay? At least for the basics, such as being, getting a vaccine, so not to die when you catch, this virus or any other virus, while the pharmaceutical, biggies are trying to make as much money, out of this crisis as much as they can. And we've seen it. There was such a competition, such a race between all these giant pharmaceuticals, to really get their vaccine and their product on the market so that they can get as much rewards as possible. Okay, so how could we have a health system which is good enough for everybody, while we have these giants trying to make as much money as possible, and they are beyond and above the government's policies, regulations, and what have you. So back to Dr. Williams here, we have contributed willingly to the emergence of the state of affairs. These multinationals didn't just emerge in a spontaneous fashion, you see, and the fact that the situation is so difficult, and yes, I used maybe too strong of a term, calling hedonistic capitalism. I like to use it once in a while to kind of,
You're fine.
I like to use it once in a while just to get the attention of people. Okay.
Oh, it's a good term. You got my attention.
So I have nothing against capitalism, really. I have nothing against people who are working hard to make money. You see, free enterprise and freedom for the entrepreneurs to work hard and get the benefits out of it, but within acceptable, how would I say it, levels and parameters. Okay. Today, I was reading something very quickly, and the boss of Amazon, you see, will make in 6 minutes what somebody in the state that is receiving the minimum wage would make during for his whole life. I mean, can we accept such kind of inequalities? You see, that's why I call it hedonistic, because the differences and the distance between those, as Dr. Williams said, between those who have and those who have not, is becoming astronomical. Okay, as I said, I agree that those who have and those who work hard can have more, but not in a way that it becomes astronomical, because there is no way that you can get that much without others getting less, because we live in a finite planet, you see, and the resources, it's like a big pie, you see. If you get 99 of the pie for yourself, Alex, I want to say to Alex this, okay, what is gonna, the 1% is gonna be for me, for Sharif, for William, and the rest of the audience, Alex, I just picked you, just because I was saying, just to make it a bit lively, all right? You might end up not liking this kind of pie I'm talking about. So what I'm trying to do is to say, we are not here because just, we couldn't only get some universal health coverage in the States, or because, some countries are still don't have good institutions, or they have corrupt governments. No, these are there. I recognize them. But there are structural problems that actually made this, that facilitated the emergence of these failures. I am a systems guy, and I do not just, look at the symptoms, because all of these are symptoms, global warming, the COVID-19, nuclear problems early on, the military also, industry, and today the pharmaceutical industry. Somehow, we have kind of got mixed up with our means and ends. Okay, so somehow the ends today became the means. So collecting the money and becoming very rich became the objective, while using the well-being of others. You see, while it should be the other way around. Whatever we are doing should be for the well-being of everybody, not, against the black or the whites or the Aborigines or the Arabs or the Muslims or anything or anybody else. Okay, when we talk about these necessities, when we talk about well-being, when we talk about dignity, okay, we have to be all equal, including animals and including any living creature. Okay, the humanity is very, very far from this level of consciousness. Okay. We are living in such materialistic, world, and we are so much motivated by materialistic possessions, that we somehow became blind, to our nature as humans, as sentient being, and as being, brothers and sisters, and we kind of became less and less empathetic with others, because you see, our brains are actually, developed and were designed so that we are naturally empathetic to others and that we cooperate with others. That's nature. But we, as human beings, and not everybody, maybe some elite, between quotes here, okay, managed to really bring out from everybody this individualism, okay, that broke this link, this human link between people, and we lost it as a species, and now we are more of pulling each one for his own benefits, rather than looking for a collective benefit that will make everybody happy and
Mhm.
live a dignifying life. Okay, go
Yes,
ahead, William.
yes, yes. Dr. William, yes.
Okay, and then I want to hear from Alex. But Alex, I'm going to set you up on this one. Listen, Joel, I don't see the future as that bleak and austere, and I don't think that that's necessarily a correct description of where we're at. Because under that description, we would not have had the any of the organizations that are essentially goodwill organizations. I'll just call them that. Whether it's Doctors Without Borders, whether it's the Red Cross, whether it's the Rotary Club, whether it's the Neighborhood Food Bank. I mean, during times of crisis, people all across the world always band together and provide what assistance they can, from the smallest of donations to the largest, those that can and are willing to do. I'm not suggesting that there is not a school of thought and a group of people out there that believe, eat or be eaten. There certainly is. But I don't believe that that's the better part, that represents the majority of the world population. And I don't want to become too esoteric, but I do believe in our better angels. And quite frankly, Alex is an example of one of those better angels. Alex?
Unmute yourself. Yes.
Thank you, William. So to get into humanitarianism, cover this subject from that perspective, and our empathy for one another. I do feel that we need more communities. We need to strengthen our communities with people. Unfortunately, this pandemic transitioned us into the digital world, so we're communicating like this. We're not seeing each other, one-on-one, face-to-face like we used to. Obviously, to make it this far with our civilization, we had to have some sort of compassion and empathy. I do think that we're not doing enough, though. There's like millions of aid organizations that are doing amazing things. In my head I can list and see so many, what they're doing around the world, how they're helping, how people are volunteering, how people are donating, who's organizing them. That's all wonderful, but as we continue to see ecosystem collapses, or our ecosystems collapsing around the world, as we continue to see climate-related disasters, weather-related anomalies, we continue to see the divide between the rich and the poor grow, or whatever it is, all the issues that we discuss in these programs, I just don't think it's enough. Like, we're just not doing enough. That's why we're seeing us extracting Earth's resources beyond their capability to recharge. That's why we're seeing increases in atmospheric temperatures. We're just not doing enough, and our society's out of balance. There are a lot of good people doing a lot of good things, but we need more people. We need more humanitarians, more environmentalists, more people caring for animals, more people promoting veganism, whatever action or sector you choose to go in. I think that it's not only honorable, it's something that's necessary. We need to transition more into a caring society where we care about the people sleeping outside in the cold. We care about the people with mental illness, the people that are on drugs. We care about the people that are too physically or emotionally weak to take care of themselves. And I think that's where universal health care comes into play, where some people, they've wore out their life hours in whatever way, or they have whatever disability or handicap. That's why I was also a strong supporter of Bernie Sanders and what he stood for, how he was addressing healthcare, how he was trying to reform the healthcare system. And I'm fortunate that I've had a chance to go to, I think, like 6 or 7 of his rallies, listen to him speak, and how he was trying to implement a lot of these throughout our society. And I think he would have really set the stage and made a huge difference if he did become president. What he was going to implement, and it's just, I'm really disappointed that didn't work out. So I did see one of the questions And getting back to this conversation, I just want to explain something real quick. Someone asked, is the new strain of the virus in the UK more deadly? And I apologize that I'm not completely caught up with that information. So I'm not going to spread misinformation. But I do want to say there's a difference between how deadly something is and how rapidly that R0 value spreads. And like Dr. Williams said, so when I go into the R value, so because I did hear, I don't know if it's more deadly. I don't think it is. I think it's similar in my opinion, but I don't know. I haven't done the research, but I do think it's spreading faster. So one of the ways it can spread faster would be when it's on a surface. Instead of it lasting 1 hour or 20 minutes, it might last 2 hours, so it might last longer, so that gives people a chance to okay, so there's also airborne. Is it more airborne? But the main reason why it would spread faster, the R0 value, it's called viral load. Now, this is an important keyword term that people watching this video should research. Everybody should know about this term. It's called viral load. So if you touch a door handle and someone else was sick, and then you touch the corner of your eye, depending on how much of the viral load it takes for you to get sick, depends on how much of it will go into your eye, into your system, and get you sick. So there's still stuff we don't know. How people are getting more sick, who's dying, is it your blood type, is it your genetics, all these other factors. But regardless of that, people have different viral loads. So one of the reasons why us all wearing face masks is not only to disperse our exhalation, but it also takes in and reduces some of those viral loads from spreading. So when we also have and we're wearing face masks, when we're inhaling, we're getting less of the viral load in our lungs, so we're less likely to get sick and die from it. Or if we do get sick, we don't get as sick. So even the people wearing masks, it does help reduce the potential viral load that COVID-19 will. Okay, so anyways, that's a cool thing to research and to know more about. I had someone asked about in the questions about how to be healthy or strong, or supplements and all of that. So I just want to go over this real quick. So to be healthy and strong and maybe be more resilient towards this virus, a pandemic, to be more prepared for the climate-related superstorms and the stress of the future. Of course, there's always diet and exercise. That's important. What you eat, the exercise. I'll go more into that real quick. So clean water is really important. Drinking a lot of water is important. Knowing how to filter water, how to clean it, how to knowing about reverse osmosis, desalination, different ways to get chemicals out of the water, any pathogens and all of that. Drinking clean water is really important. Eating whole foods is also important, and not eating processed stuff that went through machines where they're just throwing fillers in it. So whole foods are really good when we're just eating whole fruits and vegetables. Just not a lot of processed stuff is important. Of course, there's vitamins. That's controversial. What types of vitamins work, what types don't. But you don't want to eat vitamins that are, from CVS and Walmart and some of these corporate stores. You'd like to get them from like a smaller mom and pop's owned natural store where there's less fillers. They're more trusted companies and all of that. So you would do research on that. Yoga, relaxation, meditation, all of those things are really important. Having positive influences in your life, trying to surround yourself with positive people, positive influences, good music, all of that. Staying away from pollution. Learning about indoor air pollution, outdoor air pollution, move if you're next to oil refinery and all of that. So pollution weakens your immune system. So trying to be away from pollution. At the same time, just not smoking cigarettes, not doing drugs, limiting your caffeine intake, which I have a hard time with, and all of that. So, and just doing more.
The drugs or the caffeine, Alex?
The caffeine. Yeah, as I'm drinking coffee right here. Yeah, thank you. Yeah, I'm super anti-pharmaceutical and try to drink lots of water and eat organic. And I've never smoked cigarettes in my life. And I have tried my best to, live a good life. So those are some tips how to stay strong. So there's mentally and physically. We covered this in some of the previous episodes, but I hope that answered that person's question. And one last thing. healthcare and all of these subjects, again, unfortunately, comes down to politics in a lot of ways and corruption. So who you're voting into office, if we got Bernie Sanders into office, he would have changed the whole healthcare system in the United States. Depending on who your elected officials are and how you're voting for them, how you're going to city council meetings, group meetings, or however it works in your country is a big part of how the money is directed. One of the main reasons, what I've seen when I went to Iraq, when I went to Ghana, Nepal, Costa Rica, Mexico, all of these places are resources. They don't have a lot of resources, and they don't always have a secure building to have those resources. So if you live in a developing country, and I do know several doctors that have helped create, two of them specifically, Dr. T and then Philip, that helped create these little medical hubs. But first you get some community members, a secure building, then you get resources and trained people. So it's necessary, it helps improve people's quality of life, and it's a good thing to have some sort of
Yes.
medical.
Thank you, Dr.
thank
William.
you.
What do you want to add? You want to define some points? Yeah.
No, listen, I don't have to spend. That's a bit of a joke, Amir. Well, in any event, I do want to raise one other thing, and that is this: is that, this is just true for all nations and all countries, and that is this: that what we've seen with the COVID-19 pandemic, and what we know to be true, and what we know will work in the future, because we will be facing these similar situations, is that we are going to need a robust governmental arm in each nation. And that what I mean to convey when I use that term is essentially this: we are going to need to have in place in various nations around the world a rapid response team where we can set up issues such as testing, contact tracing, isolation or quarantine or sequestration measures, at least in the initial stages that we obviously didn't have. And this kind of highlights the point that Joel raised earlier, which is, why the United States has a disproportionate amount of the rate of infection and or the rate of deaths per capita when compared to the rest of the world. And that is simply because it's not that necessarily there was a fundamental flaw in our system. It's rather that we did not have a comprehensive national response. Our previous COVID pandemic response
Was cut because of Trump.
That's right, was disbanded within months of Trump taking office. So, and I believe
Horrible decision.
That's right. And to paraphrase it at the time, he essentially took the position that said that, listen, you know what I'll do? I'll hire them back when we need them. But right now, since we don't have anything on the horizon, we don't need them. And so I'll save money there. And that's a classic penny wise, pound foolish. But what we need is now we have a better idea of what we would need. We would need, once we understand that there's an issue, then we need contact tracing. Then we have to see if we can have it, if we have any off-the-shelf tests that are applicable to this particular type of strain. Or do we have to create something brand new? And in that regard, then we have to start with the preventative measures: hand washing, social distancing, face mask wearing, all of those things that we have now seen and tried out. But now we can have a formalized plan of action that in case of A, we should go to B, C. And that is the truism for every other nation. Now, that is something that we can easily take through, and each country can adapt to for themselves based on the size, the need, and the particular requirements of that country, because it's not going to be the same universally. However, I did want to add that point, in addition to the insurance coverage liability, the universal health care, the disparity, the racial and ethnic, the recruitment and training of new professionals, but a robust governmental arm dealing with pandemic response action. Because had that been done in the United States, suffice it to say, the commonly used terms are, we would have been able to flatten the curve rather than see this uncontrollable rise towards the horizon that we're experiencing. And we could have possibly avoided the initial surge, and then maybe the surge upon the surge, and then the surge upon that, or the tsunami, as Joel and Alex are talking about. But I did have one question, and that is this. Dr. Sharif, how does it look from your point of view? Do you have any thoughts or things that you'd like to add to this? Because I'm very interested, because, Malaysia was at the forefront of, in contradistinction to the United States, of controlling this stuff. You guys
Yes.
are doing something right.
Yeah. No, definitely. Two specific point I actually want to add. Number one, for developing better healthcare system, I think Professor Jalal maybe agree with me, but my findings that for developing better healthcare system, developing nations, they have to develop a good research organizations. They have to build up better ecosystems. Example, right now, how many of developing countries they are taking initiative for developing vaccine? What the reason behind that? Issue is that okay, USA, they are big economy, this is okay, but from my point of view, developing economy and this kind of thing, they also have good ecosystem. They have talent like Professor Jalal. They have many researcher, even they study from, and they finishing their research and everything in Ivy League and many places. But issue is that why developing nations do not go for the vaccine innovation? Issue is that they do not have good ecosystem. On the other hand, I do not believe that developing nations do not have enough money. Problem is that
Right.
many corruptions happening, many things happening in the healthcare system. I know that example, that there are many corruption and many things happens. That's why they do not have proper plan and executions. It's a responsibility of the politicians. It's a responsibility of the NGOs and corporation. This is this is the fact. So my question is that why we cannot develop our own research-based ecosystem? We have talent, I'm sure. I visited many Ivy League universities in Oxford, even in Oxford and Cambridge, everywhere, and everywhere talent developing nation students, they are studying. Problem is that opportunities, like example, a Malaysian youth, how he get opportunities. Example, the Indian youth, or example, the Bangladeshi or Indonesian, they do not get enough opportunities.
Mm-hmm.
So why we cannot utilize? This is our fault. This I believe personally, as a developing nations, this is our fault. This is number one. And number two issue is that what I mentioned, that corruption. We have to minimize the corruption in any ways as much as possible. When we minimize the corruptions, we can actually, for healthcare system, for educations, there, for many area, there is a big budget right now. A developing nation has budget, but definitely we have to ensure that we utilizing in a proper way. And definitely, like example, why that this is the initiative of World Talent Economy Forum. From my point of, I'm also from a very small tiny village, very small village in Bangladesh, like Rajbari. So I don't, when I go to when I actually go to the Ivy League university, when I was in Oxford University, in Cambridge University, in Harvard. So issue is that one thing I find, there is a no difference between talents and everything. It's a difference is ecosystem.
Right.
Talent is everywhere. Talent is in
Right.
Africa. Talent is in Asia Pacific. Talent is in South Asia. Talent is in USA. Talent is in Europe. Everywhere. There is no difference. Difference is exposure. Difference is better ecosystems. When students, the same student I saw, when they go to MIT or Harvard, they change all of their perceptions and everything. But question is that our developing nations, governments, corporations, do they utilize the resources in a proper way? I want to say no. Do they give them chance? They are giving them, they do not do work based on meritocracy. They do all of the things based on their, they give chance to their own family members. They give chance to their own peoples. This is different things. So I just want to share one example from Singapore. I asked them that how small places, they do not have any natural resources, they do not have anything, only they have human resources, how they become one of the developed part of the world. So few things. Number one, they do focus on meritocracy, not rely on family members. I'm sure it's happened in the developing nations. Number two, they have better policy. From capitalism, from socialism, best of the policy they implement in their countries. So any countries, if and if there any corruption happen, right the way, Singapore government take the initiative. So these three things, they said that if these three things we can implement: number one, meritocracy; number two, better policy; and number three, reducing the corruption. Definitely, any countries, they can chance to develop themselves. So my question is that if Singapore can, if small places can develop, I think India can, I think Indonesia can, I think
Mhm.
Vietnam can, I think
Mhm.
Africa can. But question is that we are not utilizing our resources in a proper way.
Right.
This is my observation. And good people is everywhere. Good people in USA, good people. I do not want, even before elections, I think Dr. William, I said that USA we cannot judge based on example the different political peoples or other things. There are many good people. Even in Africa there are many good people.
Mhm.
In Asia Pacific there are good people. That is the objective of World Talent Economy Forums. We have to create a very intellectual hub. That is the point. In any corporation right now, they're facing problems. Any academia, they're facing problem. They call, they try to get help from your solutions, from
Mhm.
our World Talent Economy Forums. This is our objective as a think tank. We want to grow and we want to reach as much as people, and hopefully it's very possible. Yeah. So sorry, I do not want to linger these sessions. I directly want to go for the concluding remarks.
Sure.
Even and I'm sure this is our audience actually really enjoys today's sessions, and they get a lot of things. And specifically when actually like Professor Jelals and Dr. William, Alex come up with the different points, they actually really enjoy. I'm sure they really enjoy these things. So I directly want to go for the concluding remark that how we can solve these things, how we can develop better ecosystem. I want to start from Professor Jelals, then Mr. Alex, and Dr. William for concluding remarks.
Thank you, Sharif. Definitely, you are giving us a chance, to mingle together and exchange ideas and learn from each other, and also listen carefully to each other, because it's much easier to talk than to listen. We unfortunately, we people have tendency to listen so that we can respond rather than we listen in order to understand and comprehend and get closer to the other. So all of us are part of the problem, as well could be part of the solution.
Mhm.
And I'm speaking of everybody, including myself. All right. The problem is highly complex. Okay, I'll start with the remark that you made at the beginning of your intervention, Sharif. You said, "How come the developing world didn't come up with a vaccine, okay, for this virus or any other virus?" Well, tell me, who are the country who came up with the vaccine? Only very few countries came up with the vaccine.
Mhm.
Are you talking about, for example, Finland? Are you talking about, France? Are you talking about
Canada.
Sweden? Are you talking about so many developed countries didn't come up with a vaccine? So
Okay.
Mhm.
saying why didn't the South come up with a vaccine is really, not the appropriate question. Okay, that's one thing. That's really a very empiric answer to your remark. The problem is highly complex, and we cannot really debate this in only one or a couple of hours. But let me, close with a couple of remarks which are general. As I said, I'm a system man, and I usually take a bird's eye view of things. I don't like to get trapped in details, because zooming into details, you end up taking the forest for the tree, and that we all know it's not the right way to do it.
Mhm.
If you take, for instance, if you bring 10 Nobel Prize laureates as economists, I mean, to your show, and tell them, gentlemen, I'm going to give you a couple of hours to give me a recipe for countries to develop. Okay? They will not come up with any recipe. and they will fight like hell, hoping that they would not injure themselves or each other. That we need to know. The best economist would tell you that. I'm not an economist, I don't have a Nobel Prize in economy, but go check Stiglitz, go check some rising stars in economics, such as Mazzucato, many top economists. Nobody knows how to develop. Whatever happened as development, we know how it did after the fact, okay? But, and this is a big but with a B, as big as the Mount Fuji, okay, is that also we have what we call the development of underdevelopment, okay? And that's a very important thing that I'm talking about. You see, let's not be naive about how this world is being run. People are not just, thinking day and night about the well-being of everybody. That's why I insisted on the commons and how to manage the commons. Of course, not everything is bleak, not everything is bad. No, I'm not saying that. But as Alex said early on, we don't have enough people who are thinking this way, who are really trying to invest their time, energy, and intellect so that we all move together towards a better life. That's the point. You see? The thing is, of course there are corruptions. Do you think there is no corruption in the States? There is no corruption in England? There is no corruption in Germany? There is corruption everywhere. Do you think that Sweden is not a tax haven? Luxembourg is not a tax haven? Come on. Let's not be naive. If the West wanted really to help and they really wanted to uphold the human rights, the first thing they should do is to really abolish these tax havens with the right global regulations. So how can anybody in developing world, such as a president, be corrupt if that president cannot send his money to some of these tax havens? And everybody knows about it. They know it. And then when they asked these countries to have transparent banking systems, they didn't accept. These Western.
Why would they? Yeah. All they care about is money.
Was that what I am saying? There are structural problems that we all know of. And if we do not tackle these problems, we will keep on facing these, crises that will really, that have the potential to erase humanity from the face of this earth. I'll finish with one last thing, just to tell you that things are complex. You see, the freedom, of mobility of capital, the free capital movement that can happen, at warp speeds between countries. When you look at it on the surface, you say, oh, what's the problem? I mean, okay, we can have money, zipping between countries. What's the big problem? No, there is no problem in essence. But when you look at it deeper, let's assume that you have some of these, capitalist people, investors that go and invest in Bangladesh, okay, in your country, and then they put a lot of money so that they take advantage of cheap labor and whatever the country is giving them as advantages. They might ask for more, or anytime the country does something that is not, congruent with their benefits, they will take away their money instantaneously somewhere else, and you are left with no capital or whatsoever to develop your country. So even worse, that movement of capital puts democracy on a very on the spot and weakens democracy because the government of your country and my country is incapable of facing up to this movement and consequently are obliged to respond to these capitalist entrepreneurs and work along their desires. So development is not corrupt government in underdeveloped countries. As a matter of fact, the problem is not only in our countries who are underdeveloped. The problems are everywhere. It's called global inequalities. Go to the States and you will see how high global inequalities are. So there are tremendous inequalities between the have and the have not in the United States. So I'm not just developing, I am not just trying to defend, the underdeveloped world and, against the West. No, I'm just trying to defend those who don't have anything and that are struggling to make a living, which are the 99% and the 1%, which is really gobbling, most of the wealth of the country, not investing enough and perpetuating, and if not, exacerbating the situation of the poor in the world and, between nations and within nations. Thank you.
Thank you, professors. I learned a lot from you, and beside that, I just politely, I want to give you one specific example. I always, based on evidence, I always try to work based on research and the real fact. Example, for these vaccine issues, I'm sharing one of the specific informations. Maybe it will be helpful for understanding that what's going on. Example, okay? Do you see? I'm just sharing one of the things. Okay, this scientist you see, okay, the scientist from Bangladesh, and he's a Bangladeshi scientist. His name is Mr. Asif Mahmood, and he's working for Globe Biotech. You can do all of the research. I share all of the things. So Globe Biotech, this man, he's trying to produce vaccine. Okay. And initial stage, he gets some approval from WHO. So Globe Biotech Limited has claimed to be first company from Bangladesh to have COVID-19 vaccine under development. Okay. It says it is aiming for the December 2020 availables of the vaccine in the markets. They received the result after conducting the preliminary trial of the 5 rabbit from June 10 to June 28, says Dr. Asif Mahmood. Okay, he's a scientist. He's a scientist for the Globe Biotech, and they do these things very well. And it's July 6, 2020, right? It's July 6, 2020. This report. Okay. And these reports from Business Insider, very important
Good.
source of news, and I have all of the evidence. But issue is that today is 30 December 2020. What is the result? I'm sure this scientist is very much capable to produce this vaccine. Who stopped his initiative? Is it the foreign company or is it the local ecosystem? My questions, it's evidence. Who stopped? Foreign company come and say, okay, you cannot produce it. Or the local ecosystems, I do not want to mention someone, stop his initiative. Talent, that is my point. Talent is everywhere, but we have to utilize it. Talent is in developing nations, talent is in Africa, talent is in Sri Lanka, talent is in Malaysia and everywhere. The difference between, example, Bangladesh and Malaysia, Mahathir bin Mohamad, he used a lot of talented people. Like Malaysia, Singapore, compared to this kind of developing nations in Asia Pacific, they use human resources in an effective way. Singapore, it's experience. I can give you 1,000 of reference. 1,000 at least, even if you give me another 10 hours of time, I can give. So this is reality. Emotion, actually real life emotion is different. but fact is different. I give you the result of 6th July information. You can check. Everybody can check. Our audience can check. This is 30 December. He claimed I can come to the market in between December. Why he cannot come? What is the reason behind that? Who play behind these things? These are, I know many talented people around the world. Because of the lack of ecosystem, they cannot do. Same people from India, same people when they go to USA, they become CEO of Microsoft, they become CEO of Google. But if they are in India, I do not want to blame India or some things or developing nations, they do not get chance. Why I leave my country? And that is the reason of brain drain. So always, if I'm very honest with you, it's I strongly work in the industry as well as academia, and I try to learn. Even I'm really learned a lot of things from Professor Jalal, Dr. William, Mr. Alex, and every time I'm learn new things. But I'm really honest with you. I'm sure young people has many talented, but we need proper support. We need proper ecosystem. I'm sure developing nations has huge potentiality. They are very they have human resources, they have resources and everything, and they can do many things. We need to give them proper support. That's it. That is the objective of World Talent Economy Forum. And that's why I believe that that is the reason why the developing nation cannot produce the vaccine. You can do research. I'm sure you get ultimately the answer. So like Dr. Jalal, if you want to add anything, I'm open. I love to learn. And beside that, Mr. Alex and Dr. William, if you want to go for the concluding remarks.
So thank you, Sharif, for telling us all of that. It sounds extremely frustrating to see how he produced the vaccination and the potential, and coming from a developing country. So I'm also wondering the same thing, like, why wasn't that mass produced? Why didn't he have why didn't people trust in him more? Why didn't he have more credibility if all the information was right there? Just like Business Insider, which is a really reliable source of information, really good journalists. They have a international platform, and it's concerning and disheartening that he received that response and he wasn't able to proceed. So I'm guessing that it's just like maybe trust from developing countries. I don't know what else it would be if it's not trust or corruption, or I wonder if it has to do with the news media, because when you get on the news media here, it reaches such a large audience. But he was in Business Insider, so it seems like he was able to promote what he had through there. So again, really concerning. Like you said, July, we would have or could have possibly had the vaccinations mass produced much earlier, which would have essentially saved lives. So I do want to mention, which has been brought up, the solutions to what we're talking about is extremely complex, and every country is different. So there's a variety of different ways to address the problem. One of the things that we did not discuss in this program is medical debt, how you go in and you go to the ER, you go to the hospital, and you get into debt, and then you either have to file a bankruptcy, you have to make payments over 10 or 20 years, or just how much it disrupts your life, and how much they charge here in the United States for ER visits, for prescription medication and all of that, compared to other countries that you can get the same exact prescription medication for such a smaller amount of money. So there's obviously corruption, and they're making way too much money, I think, in the medical industry here with how much they charge for even basic services, pharmaceuticals, prescription medication. And I think this has to do with what William was talking about. Is we have $4 trillion, and it's just inefficient. Our system here is inefficient. Like Sharif was mentioning, with the healthcare system in developing countries, with the three things he mentioned, and corruption, it's just causing it to be inefficient. And when a system is inefficient, who's suffering? The people with disabilities, with mental illness, the homeless people, the people that are physically and mentally disabled or have chronic illness. Those are the people that are suffering. The people that are now in medical debt are the people that are suffering. So so efficiency, I think, is a huge, broad way that we can fix this overall system. I do want to mention, to reiterate what Dr. William had said. So in the United States, this is just important to know, good information. The United States did used to have like a whole office that was for pandemic response. I don't know a lot about it, but I think it was put together under the Obama administration, and it was to potentially avoid any pandemic or to see epidemics happening in other countries and wondering the potential it has to spread around the world, how we can help reallocate resources to address that epidemic so we can stop it before it spreads around the world. So we had a whole office somewhere in Washington, I assume, of scientists, epidemiologists, virologists, focused on studying and researching and watching epidemics from spreading, because there's a lot of other stuff. It's not just Ebola. There's Zika, there's the coronavirus, there's swine flus and bird flus, and a lot of other stuff that they're paying attention to. So under the Trump administration, like William said, within months, Trump dismantled it. Having an office like that is kind of like having insurance. Just like I studied at a community college, biological first responder, it's not a matter of if it's going to happen, when is it going to happen? So why do we not have that office? And as the United States, if you feel comfortable calling it a global superpower, we have the finances out of that $4 trillion that we could easily have an office, whether it's 10 employees or 100 employees, focused on this aspect. Because as we continue to see, like I mentioned earlier, the glaciers melt and the permafrost around the world, we will continue to see new strains of viruses emerge. So as Dr. William also mentioned, contact tracing. So the reason why it was so difficult with this pandemic, with COVID, is because it generally takes 2 to 14 days if you're looking at the CDC, or 1 to 14 days if you're looking at the World Health Organization, for this to show symptoms. But since so many people are potentially asymptomatic, where they're not showing symptoms, it's harder to contact trace the people they are in contact with and where they went. I actually just got tested 4 or 5 days ago. I got my results two days ago. So I've now gotten tested 3 times, negative all 3 times. I'm fortunate that I have access to that testing, but we also need more testing around the world. If we did more testing when someone is sick with corona, that means they can isolate, they can quarantine, they can be more cautious. So that would also help reduce the R0 value and help us gain control. So testing is also really important. And then I want to summarize. So one career opportunity is, 2. One is, there's going to be more disasters because of climate change. We are going to see more superstorms, more forest fires, more blizzards, more dangerous stuff happening around the world because we're out of balance because of climate change. So right now is a good opportunity, if you're a good, strong, healthy, brave young person, to get involved in taking the Red Cross courses, then going into the EMT course, taking some paramedic courses, because we are going to need more first responders around the world. Not only is there a shortage of environmentalists and humanitarians, there's going to be a shortage of first responders, whether you're going into fire technologies, emergency medical technician, or to become a doctor, or possibly team up with the United Nations or Doctors Without Borders, or any of those wonderful organizations. And so one last thought is, if you're ever sick and you have someone there to bring you soup, take care of you, ask if you need anything, you remember how you felt disabled and you didn't have the ability to go out and function or to do the things that you need to do. Whenever I've broken bones or been severely injured, I know what it's like to be limited in certain functions and everyday functions or things that I need to accomplish. So what we're seeing in America and what we're seeing in the world are a lot of people that they're not functioning. They have chronic illnesses, disabilities, drug dependence, whatever it is, that they can't necessarily take care of themselves. So they need some sort of medical, and that's why universal health care would be so important, because once people have reached that point that they can't take care of themselves, I mean, they're practically like dying on the streets in America. It's disgusting how many homeless people are everywhere that just can't even take care of themselves, that don't even know the steps or the process to go through for Medicare, Medicaid, or whatever that is. So I just think that universal health care would help a lot of them to be able to just go into a hospital or a doctor's office, get the help they need to be strong and live a prosperous life. And it would in overall help our economy thrive. And it's just, it needs to be done for our transition towards a caring society and live in a utopian civilization. So that's my concluding
Thank you.
remark.
Thank you. Dr. William.
Yeah, listen, I want to say thank you. I always love these conversations, and I love them a great deal. I want to begin in a bit of a reverse order, at least according to my list, and that's because I want to highlight 2 points that Alex made. Starting with the pandemic response office here in the United States. That's under what I would call a robust governmental action team that every country can put into place.
Right.
It's the burden, I would argue, just as Alex I think has intimated, is on the United States, because right now we have the resources, and it's an inflection point where we can lead the way, both not only literally but also in terms of actions, because it resulted just historically from Obama's reaction to the Ebola outbreak, and then we did it here, and then we sent professionals over there to take care of the outbreak over there, so it didn't turn into a worldwide pandemic. But you're absolutely right. Now, the other thing is that I'd like our audience just to kind of focus in on this concept that Alex has raised, and it's very true. One of the unforeseen consequences of the global climate change is the melting of the permafrost. Now, we often think of that as directly linked to the rising of the world's oceans, and yes, that is true. We also think of it in terms of excess and extreme weather conditions. Yes, that is true. But it is also true that frozen in that ice are not just woolly mammoths and saber-toothed tigers and old
Relics.
yeah, and animals and things, but it's viruses and bacteria that have been frozen in some cases maybe millions of years, and then ice caps melt and open up and release into the air. All those viruses and bacteria will be released, and we just don't have the immune system to deal with it, because we, as a species, we're not raised in that environment, so that we have no natural defenses, and that's just
Antibodies.
benefit from unforeseen consequence from the environmental climate. So I do want to point out that the permafrost melt is real. The danger from permafrost melt is real. And the need for a rapid, robust arm in every country to deal with immediate pandemic outbursts is real. So I just want to underscore that piece for Alex. The other thing is emerging job opportunities, which is also true. The pandemic has shown that we don't nearly have enough EMS, emergency service workers. We don't have enough nurses. We don't have, and this is across the globe. The United States is only 330 million people, and I say that once I thought that was an amazing number until I started thinking about the Asian Pacific. I mean, we're merely a state in the nation of India. I mean, we're like a decimal point. So when you start talking on that measure, that scale, and the need, anybody educated in those areas and those fields are going to be needed the long term as whatever we do with regard to the improvements. And so, yes, there's an emerging area of useful, meaningful job opportunities, and it fits with one of the 5 things that we need to do, which is to recruit and train for the future. Particularly now, since being a first responder may not necessarily have the glamour that it once had, because people have seen what it really takes when you have a worldwide pandemic.
Right.
Notwithstanding that, although, and I want to ground this again in terms of what COVID necessarily means for the future of healthcare policy, not just here in the United States, but across the globe. And that is that one, we've got to, take another look at least here in the United States, is the expansion and the expanse of our insurance coverage. And that includes where they can operate, how they can deliver health care, whether it's through telehealth, which is medical visits, or telemedicine, which is the ability of doctors in one state to prescribe medication to patients in another state, even if they're not in a registered clinic or at a registered facility, because currently that is a violation of the laws that are enforced by the Drug Enforcement Administration. That's just another one of those institutional barriers. But we have seen that remote collaboration and telehealth and telemedicine is going to be here to stay. And that's something we ought to divert our resources as we save into, because that spreads our breadth and our reach and hence increases the insurance coverage. And then what that also does is that then begins to address the issue of racial, ethnic, and economic inequality. And I say racial, ethnic, and economic inequality because, quite frankly, there are poor people of all different races, colors, creeds, and religions around out there, not only in the United States, but around the world. And so, on the one hand, I don't want to pigeonhole the need and our ability to meet the crisis as it being indicative of just one small group or subset of that group. It is, in fact, across everything. It covers the entire rainbow. And to the extent that we experience the COVID dividend, either in the reductions of insurance costs, administrative costs, by the reduction of barriers, and the efficiencies reached by telehealth and telemedicine, we can then begin to reallocate that dividend with how we approach our healthcare policy here in the United States. And I think it really ought to move towards universal health care. Then we can begin to apply those in areas so that we can then minimize the disparities between economic, racial, and ethnic inequality. But we can only do that if we start somewhere. And quite frankly, it could be true. And I'm gonna end with a quote because a good friend of ours here at the program, Dr. Churchill, his grandfather, Winston Churchill, said that never let a good crisis go unutilized. And so here we have COVID-19, and it is a worldwide crisis. And so for all the reasons that Professor Jalal highlighted, the need for increased international humanness, understanding, comparison, open dialogue, along with Alex's call and longstanding call for activism at all levels and an active engagement in our society, whether it's local, state, national, international, whatever it be, in whatever subject areas. That is true. And whether it's concrete policies and programs that are designed to actually save hard dollars and then to reallocate those dollars. I'm once reminded that somebody once said, listen, you want to see somebody's values, show me their budget. I'll tell you what their priorities are. You tell me where they're putting the money. Let me see where they're saying, hey, this is where I want to put the money, and I'll show you what their priorities are. But the point here in the larger context is that COVID-19's impact on healthcare policy moving forward is both immense. It holds promise for the future, and all of these saving measures, it holds forth at least kernels of opportunity that we can begin to address longstanding problems. But it is also a crisis that we should not fail to utilize, invoking Winston Churchill on behalf of my friend. But I still remain optimistic. It's daunting. It's going to get bad. But either way, the alternative to being optimistic and looking forward and having tough discussions now is to do nothing. And we know what that will result in, which is essentially death for everyone. So with that, hopefully, putting into perspective,
Right.
Once again, I'm reminded of the sheer brilliance and reach of the program, World Town Economic Forum. Dr.
Yes.
Sue.
Yes, thank you, Professor Jalal. Thank you, Dr. William and Mr. Alex. Actually, I'm sure today's session, even I'm observing that from today's session, actually many people sharing our session because of, I think they are getting a lot of information which is valuable. And beside that I just want to share that World Talent Economy Forum, why we build up this kind of concept and this kind of think tank. Like I just share in between 2 minutes and I will finish this session for today. Like when I was in University of Cambridge, I saw that Sir Jagadish Chandra Basu, he has a very, very good impact in science and technology. Like he do research on radio, he do research on place on radio development, plant research, many things. So actually, like developing nations, we have many resources, many talented. I'm
Definitely.
sure Africa has resources, Asia Pacific has resources, South Asia has resources, Middle East has resources. But issue is that we have to utilize our resources. It's not only corruption.
Right.
I know every country has corruption, but issue is that how we can develop the ecosystem. Because
Mhm.
if we want to develop your economy, develop your nations, we need to give chance to the scientists. We need to develop a
Mhm.
scientific society. We need to develop different kind of innovative things. So this is our objective World Talent Economy Forums. We want help from Dr. William, Professor Jelals, Mr. Alex. We have hundreds of guests from around the world. They are joining in World Talent Economy Forums. What is our objective? Our objective, we want to develop a better future for our youth community,
Mhm.
better content, better guidelines, better objective for our youth community. We want to develop the youth. Ultimately, I have a chance. I'm from a lawyer's family. I have a chance to go to the and they are very well established. But I do not go. I choose academy. Only reason in my
Mhm.
life I find that with academy you can change many people's life. If you change like if you teach one people's, he can change many things. If you can want to change the whole nations, just improve the academy, just improve the research, improve the quality of educations, and give a better ecosystem for the talent people. I'm sure Dr. Asif and many talented people around the world, they will change our life, they will change our country, and they will change the society. And that is the way we need global community. We need global relationship. I learn a lot from about Africa from Professor Jalal. I learn a lot about California from Mr. Alex. I learn a lot about policy from Dr. William. So that is the objective. This is not only our things. I'm sure those who joining in World Talent Economy Forums, every audience learned a lot, and we get a very good feedback. At least 10 different school, college, university, every day they're joining and collaborating with World Talent Economy Forum. And I'm sure in between 2021 we will reach 100 of million people. I just want to give you guarantee, like the tomorrow from one of my guests, he may join from if internet and everything okay, from
Wow.
Himalaya, where internet and everything is not available. He is highly educated group of people live there, and they are distributing our content with the young community, even in Himalaya. I think Mr. Akku will join tomorrow's sessions, and I request Dr. Alex, Dr. William, and Mr. Professor Jalal to join tomorrow's session. Tomorrow's session will be very much informative and effective for the climate change, and not only in like in Himalaya, many remote area, now they are utilizing your concept, utilizing your thoughts. So that is the things. If we can change human lives with proper education, I'm sure many things we can change. And that is the point we develop World Talent Economy Forums. We need talent and we need some economical involvement. And if we can integrate this talent people together, we can create a better economy, better ecosystems, and better world. So that is the objective. Thank you. Today's sessions is awesome. It's an excellent. Thank you, Professor Jelal, for in a short period of time you joins Dr. William and Alex. Thank you, our honorable audience, those who always supporting us and come up with a different question, which is really helpful for our sessions. Thank
Mhm.
you, everyone.
Definitely. Yeah. Thank you.